You can go ahead.
Hi everyone, good morning. And I'm so glad to see so many of you all have joined on a Sunday morning. So that means you've given your health your priority. So that's wonderful. So, without wasting more time, let's start with the session. So my name is Madhi. I'm from Bombay and I'm the health coach at SugarFit. So I welcome you all today. I'll be talking about diabetes and hypertension and how you can prevent it, how you can treat hypertension, even if you have diabetes, with simple lifestyle modifications. And I'll be deep diving into DASH diet. So have you heard about DASH diet before? I just want to ask, our warriors, have you heard about it? What do you know about DASH diet? So I want it to be an interactive session. Okay, I'll be speaking both in English and Hindi, so don't worry. तो मुझे जानना है कि आपने डैश डाइट के बारे में सुना है या नहीं, और अगर सुना है, what do you know about it? All right, so DASH diet is basically, it's called as dietary approaches to stop hypertension. ठीक है? And so firstly, let's start with understanding what is hypertension. So what is hypertension, warriors? What do you know about it? What is a normal blood pressure? What is a high blood pressure? Hello? Am I audible?
Yeah, Madhi, you are audible. Those who are not able to hear when you are joining, आपके device पे एक option दिखेगा, use join using the device audio or join using the headphones. So you can choose one, and might be device is better. So please join using the device audio and start listening to the session. I think it is audible to each one of you.
परफेक्ट। तो बहुत लोगों को पता है कि जो ब्लड प्रेशर, नॉर्मल जो ब्लड प्रेशर हमारा, वो है 120/80। तो ब्लड प्रेशर का मतलब क्या होता है? सो यू कंसिडर योर ब्लड वेसल एज अ पाइप, लाइक अ वाटर पाइप। तो जो ब्लड वेसल होता है, उसमें जब ब्लड फ्लो होता है, सो ब्लड इट बेसिकली एक्सर्ट्स अ प्रेशर ऑन द वॉल्स ऑफ द आर्टरीज। ओके, तो वो नॉर्मल ब्लड प्रेशर है 120/80। लेकिन जब ब्लड वॉल्यूम बढ़ जाता है अंडर सर्टेन सिचुएशंस, या अगर हमारा जो ब्लड वेसल वॉल है अगर वो स्टिफ हो जाता है, द ब्लड प्रेशर विल गो हाई। सो कौन से कंडीशंस में आपके ब्लड वॉल्यूम बढ़ते हैं, या अंडर व्हाट कंडीशन आपके जो ब्लड वेसल वॉल्स है वो स्टिफ होने लगते हैं, वी विल बी अंडरस्टैंडिंग दैट इन डिटेल टुडे। ठीक है? सो बेसिकली आपके जो ब्लड वेसल वॉल्स होते हैं, आर्टरीज होते हैं, वो बेसिकली इलास्टिक होते हैं। सो हाउ यू एबल टू पुल एन इलास्टिक बैंड, वो बेसिकली स्ट्रेचेबल होता है। वैसे ही आपके जो ब्लड वेसल वॉल्स होते हैं वो काफी इलास्टिक होते हैं। सो अंडर वन ऑड कंडीशन, अगर आपका ब्लड वॉल्यूम भी बढ़ता है, तो ये जो आपके ब्लड वेसल वॉल्स है वो डायलेट हो जाते हैं, मतलब वो डायमीटर में बढ़ जाते हैं, विच अलाउज द ब्लड टू फ्लो स्मूथली थ्रू द ब्लड वेसल्स। ओके, सो दैट्स हाउ योर ब्लड प्रेशर इज मेंटेन्ड। लेकिन अगर कॉन्स्टेंटली आपका ब्लड वॉल्यूम हाई रहता है, या अगर आपके ब्लड वेसल वॉल स्टिफ हो जाते हैं, रिजिड हो जाते हैं, दैट्स व्हेन द ब्लड प्रेशर इंक्रीजेस। सो नॉर्मल ब्लड प्रेशर इज 120/80 एंड एनी ब्लड प्रेशर 140/90, अगर उससे ज्यादा होता है, दैट मीन्स योर ब्लड प्रेशर हैज गॉन हाई। ठीक है? सो लेट्स अंडरस्टैंड कि कौन से कंडीशंस में आपके ब्लड वेसल वॉल स्टिफ होते हैं, अंडर व्हाट कंडीशंस योर ब्लड वॉल्यूम इंक्रीजेस। तो सबसे पहला हमें समझना है कि जो इफ यू हैव अ क्रॉनिक डायबिटीज, अ हिस्ट्री ऑफ क्रॉनिक डायबिटीज, मीनिंग 20 सालों से या 30 सालों से अगर आपको डायबिटीज है, या अगर आपके ब्लड शुगर लेवल्स हमेशा 200-300 के करीब होते हैं, अनकंट्रोल्ड डायबिटीज, इससे क्या होता है, जो हमारे ब्लड शुगर्स होते हैं वो जाते हैं आपके ब्लड वेसल वॉल्स को डिस्ट्रॉय करते हैं। ओके, सो जो इलास्टिक नेचर प्रॉपर्टी होता है हमारे ब्लड वेसल वॉल्स का, वो खत्म हो जाता है, एंड दे नाउ बिकम वेरी रिजिड। ओके, इट्स नो मोर इलास्टिक। तो क्या होता है, ये काफी रेजिस्टेंस होता है, हमारे ब्लड फ्लो को काफी रेजिस्टेंस फिर क्रिएट होता है। ओके, सो अनकंट्रोल्ड डायबिटीज और लॉन्ग स्टैंडिंग डायबिटीज से आपके ब्लड वेसल वॉल्स स्टिफ होने लगेंगे। सेकेंड थिंग, ब्लड वॉल्यूम अगर आपका बढ़ता है तो भी आपका ब्लड प्रेशर बढ़ेगा। सो व्हाट आर द कंडीशंस अंडर व्हिच योर ब्लड वॉल्यूम विल इंक्रीज? 3 कंडीशंस है। सबसे पहला कंडीशन, बहुत लोगों को ये लगता है कि नमक खाने से वाटर रिटेंशन होता है, लेकिन एज पर द अमेरिकन हार्ट एसोसिएशन, नमक खाने से आपका ब्लड वॉल्यूम नहीं बढ़ेगा। ओके, तो कितना नमक आपको दिन में खाना है? अराउंड 1 टीस्पून, मतलब आपको 2300 milligrams of sodium आपको allowed है, even if you have high blood pressure. That is equivalent or equal to 1 teaspoon of salt. तो अगर आपका blood pressure 140/90 भी है, 130/80 भी है, you are still allowed to eat 1 teaspoon of salt in the entire day. तो जितना नमक हम कुकिंग में यूज करते हैं, आपको उतना अलाउड है. डू नॉट कट डाउन द सॉल्ट इनटेक व्हाइल कुकिंग. तो कौन सा नमक आपको अवॉइड करना है? एक्सेस सॉल्ट इनटेक इन द फॉर्म ऑफ बेकरी प्रोडक्ट्स लाइक ब्रेड्स, बिस्किट्स, खारी, टोस्ट. बहुत लोगों को आदत है, ब्रेकफास्ट से पहले वो बिस्किट्स खाते हैं चाय के साथ में, वो शाम को रस्क लेते हैं, बिस्किट्स लेते हैं. इवन इफ इट्स एन ओट्स बिस्किट, इवन इफ इट्स अ मल्टीग्रेन बिस्किट, यू विल हैव टू अवॉइड दोज बिस्किट्स, क्योंकि उसमें नमक रहता है. दूसरी बात, आप जब ग्रोसरी शॉपिंग करने जाते हो, हम अक्सर पेशेंट्स को पूछते हैं, व्हाट डू यू सी व्हेन यू गो फॉर ग्रोसरी शॉपिंग? डू यू रीड फूड लेबल्स? तो वो कहते हैं, हाफ द पीपल से दे डोंट रीड फूड लेबल्स. दूसरी जो आधे 50% है, वो कहते हैं हम फूड लेबल पढ़ते हैं. तो व्हाट दे रीड, दे जस्ट रीड द प्राइस, वो मैन्युफैक्चरिंग डेट, एक्सपायरी डेट, बस वही पढ़ते हैं. You need to go to the nutrition label and read the nutrition label and see what ingredients are used in the products. तो अगर आपके फूड लेबल पे मेंशन हुआ है, वहां पर सोडियम लिखा हुआ है, वो आपको नहीं लेना है इफ यू आर डायबिटीज इवन विदाउट ब्लड प्रेशर प्रॉब्लम. तो बहुत सारे अलग अलग नाम से सोडियम यूज किया जाता है फॉर मार्केटिंग पर्पस. तो MSG is one such name that they will use, okay, like monosodium glutamate, sodium bicarbonate. आपको ये दोनों particularly check करना है कि ये particularly are these things mentioned on the food label? अगर mention है, आपको avoid करना है. दूसरी बात, excess salt in the form of spices. Okay, बहुत सारे मतलब ready to cook spices like like for example those of you who eat non-vegetarian foods, जैसे कि चिकन तंदूरी मसाला, बिरयानी मसाला और वेजिटेबल कोरमा मसाला. तो ये सारे जो मसाले होते हैं, इनमें काफी सारा सॉल्ट होता है, वो आपको अवॉइड करना है. यू डोंट हैव टू कट डाउन द कुकिंग सॉल्ट. ठीक है. फिर बहुत सारे लोग कहते हैं हम फ्रूट सैलेड खाते हैं, उसमें चाट मसाला डालते हैं. चाट मसाला यू हैव टू अवॉइड बिकॉज दैट कंटेन्स सोडियम. आप आमचूर पाउडर यूज कर सकते हैं, दैट इज ड्राई मैंगो पाउडर, बिकॉज दैट डजंट कंटेन सोडियम. तो एक्सेस सॉल्ट इंटेक खाने से वाटर रिटेंशन होता है, जिससे ब्लड वॉल्यूम बढ़ेगा और जिससे आपका ब्लड प्रेशर बढ़ेगा. दूसरा ये है कि अगर आपको लॉन्ग स्टैंडिंग डायबिटीज है, अनकंट्रोल डायबिटीज है, यू हैव नॉट मेड द लाइफस्टाइल मॉडिफिकेशंस, उससे क्या होगा, आपका किडनी अफेक्ट होगा. और अगर आपके ब्लड वेसल्स किडनी में अफेक्ट होते हैं, तो सॉल्ट एंड वाटर दोनों रिटेंशन होना स्टार्ट हो जाएगा. तो दैट इज अनदर रीजन, अनकंट्रोल डायबिटीज फॉर वाटर रिटेंशन. तीसरा, और जो बहुत
Madhav, we can take in English majorly, and then in just you can explain in Hindi, because major people, they are not able to understand Hindi.
All right. So I'll speak in English, and then maybe if someone needs a revision,
Just explain in one line in Hindi so that they can get the clarity.
Perfect. And the third reason why there could be water retention or why the blood volume could increase is because of excessive sugar intake. So you don't have to cut down salt if you have hypertension. You have to cut down the sugar intake. और ये sugar intake कहाँ से आता है? Majorly from tea. बहुत लोगों को ये आदत है, we have that habit of drinking a pre-breakfast tea, then breakfast के time पे चाय पियेंगे, then in the evenings you will drink tea. A lot of people drink bedtime tea. So दिन में 4-5 बार चाय हो जाता है. So every time you drink a cup of tea, you're adding 1-2 teaspoons of sugar, around 4 to 5 teaspoons of sugar in the entire day. That is going to cause insulin resistance. Your insulin levels will constantly stay high. If your insulin levels are constantly high, that is going to cause water retention, जिससे blood volume भी increase होगा, and that will result in high blood pressure. So the recent study and the recent research doesn't say that salt causes hypertension. It says sugar causes hypertension. And that is why diabetes patients are 2 times more likelier to be having a higher blood pressure. Okay, so I hope you've understood what is the reason for high blood pressure. It's increased blood volume and increased stiffness of the blood vessel walls because of uncontrolled and long-standing diabetes. So we come to the baseline, we come to the importance of the lifestyle modifications. Abhi iske liye, if you have diabetes or if you have high blood pressure, so what are the complications? So one of the complications of hypertension is that आपके जो small capillaries होते हैं, the small blood vessels in the eyes, they can get ruptured. Imagine a water pipe on the road. If the water volume in the pipe increases, what will happen? After some time, the pipe ruptures, it breaks, right? The same thing happens in our body. The small capillaries in our eyes, if you have constant hypertension since many years and many months together, it results in rupture of the blood vessels in your eyes, resulting in a lot of leakage, तो आपको वो redness दिखेगा. Okay, and this can actually result in blindness and vision loss. So do not take, hypertension very lightly, and even diabetes. So try to, adhere to lifestyle modifications. And it is, there's a very beautiful quote that says, if your lifestyle is correct, you do not need medications. But if your lifestyle is incorrect, medicine is of no use. तो कोई पेशेंट्स कहते हैं हमको सिर्फ मेडिसिन दे दो हम ठीक हो जाएंगे. आपका मेडिसिन काम ही नहीं करेगा. इट विल नॉट फंक्शन ओनली इफ योर लाइफस्टाइल इज नॉट करेक्ट. So now we come to the main topic, that is DASH diet. So as I told you, what is DASH diet? It is dietary approaches to stop hypertension. ठीक है? Neha, can we move on to the next slide, please? Okay, so before I move to the DASH diet, why is it important to measure your waist circumference? I'm very sure, most of your coaches must be telling you once every week, just log in, just punch in your waist length, your body weight. They keep on telling you once every week, fix a day. Why? Because waist circumference is very important. आपको waist, बहुत लोग कहते हैं हमारा weight तो कम हो रहा है, तो ठीक है ना? No, it is not proper. अगर आपका weight loss हो रहा है, it is not necessary कि आपका fat loss हो रहा है. It could be your muscle loss. So weight loss is not a very good indicator, and it cannot be considered alone. It should be taken into consideration along with your waist and hip ratio. क्यों? क्योंकि बहुत सारा हमारा जो body fat होता है, it's around the lower body. Upper body, we usually do not have too much of fat. Our body fat is concentrated towards the abdominal and the buttocks region, the hips region, right? And that abdominal fat is what causes insulin resistance. और अगर insulin resistance होगा, water retention होगा, and blood volume increase होगा, जिससे hypertension होगा. So ये बहुत important है कि आप waist circumference आपका हर हफ्ते check कीजिए to see if you're able to lose that, the waistline. And diet के साथ में exercise काफी important हो जाता है. Not just walking. Walking is not exercise. बहुत लोग कहते हैं हम walking करते हैं 10,000 steps. वॉकिंग से आपका वेस्ट लेंथ कम नहीं होगा, वेट कम होगा. आपका वेस्ट लेंथ किससे कम होगा? वर्कआउट से, एक्सरसाइज करने से, स्ट्रेंथ ट्रेनिंग से. तो जैसा जैसा आपका अब्डोमिनल फैट कम होते जाएगा, वैसे वैसे आपका ब्लड प्रेशर भी कंट्रोल होगा, क्योंकि आपकी ब्लड शुगर लेवल्स कंट्रोल में आ जाएंगे. ओके, द नेक्स्ट पैरामीटर इज द वेट, बॉडी वेट. तो ये बहुत इंपॉर्टेंट हो जाता है आपके बीएमआई के, अकॉर्डिंग टू योर बीएमआई, दैट हाउ मच वेट आर यू लूजिंग एवरी वीक. तो अगर आपका BMI अगर 30 and 35 के above है, you need to lose on an average 4 to 6 kgs per month. Okay, and this whatever weight you're going to lose is not supposed to be muscle. It's supposed to be more of body fat percentage. And how do you know that? By checking your waist circumference. So body weight, waist circumference need to be taken together and considered together to see if you're losing body fat or the muscle mass. Can we move on to the next slide, please? So if you see, why do you have to lose weight? It's very important. So 5 to 10% reduction. The latest researchers say कि अगर आपने महीने में 5% भी अपना weight loss किया, आपका blood pressure कम होगा by 5 to 10 points. तो अगर आपका blood pressure 140/90 है, and if you're able to lose 5 to 10% per month of your body weight, your blood pressure from 140/90 will come down to 130/85. So imagine if every month you're losing 5% of your body weight and waist circumference, how beautifully your blood pressure will be coming under control, and you can go off medications for blood pressure just by adhering to the lifestyle modifications. So now we come to the next point, that is DASH diet. So can we move on to the next slide, please? Yeah. So I want you to all take a screenshot of this. अगर आप notes बना रहे हो तो notes बना लीजिए. So what is DASH diet? Dietary approaches to stop hypertension, to prevent hypertension, or to manage hypertension. तो basically हम 3 nutrients पे focus करते हैं यहाँ पे. That is potassium, magnesium, and calcium. ये 3 nutrients है. अक्सर हम patients को सुनते हैं कि वो सिर्फ कहते हैं मैडम हमने carbohydrates कम कर लिया, हमने proteins बढ़ा लिया, fat कम कर लिया. सिर्फ ये 3 nutrients पे focus करने से आपको 100% result नहीं बनेगा. You have to focus on the micronutrients as well. That is your calcium, magnesium, and potassium. So your DASH diet basically is a very, designed in a beautiful manner that includes these nutrients. Plus, they also, they focus on things like whole grains. They focus on fruits and vegetables. I hope you're all aware of the tea plate method. That is 50 to 40% of your plate should be vegetables, 30% should be proteins, 25% should be carbohydrates. If you follow the tea plate method, you will be able to achieve 6 to 8 servings of vegetables and 2 to 3 servings of fruits. Okay. बहुत पेशेंट्स हमको ये भी कहते हैं, मैडम हमको फ्रूट्स अलाउड नहीं, हमको डायबिटीज है, लेकिन वो चाय में शक्कर डाल के जरूर पियेंगे, वो चाय के साथ में बिस्किट जरूर खाएंगे, लेकिन फ्रूट्स नहीं खाएंगे. सो यू हैव टू स्टॉप दोस हैबिट्स एंड इनकलकेट अ हैबिट ऑफ ईटिंग एटलीस्ट वन फ्रूट एवरी डे. फ्रूट्स बेड टाइम पे नहीं खाना है, फ्रूट्स खाने के साथ में नहीं खाना है. डू नॉट मेक फ्रूट जूसेस एंड ड्रिंक, मिल्क शेक बना के नहीं पीना है. ईट फ्रूट्स एज दे आर इन द नेचुरल फॉर्म. टेक इट एज अ मिड मॉर्निंग स्नैक, दैट्स द बेस्ट टाइम टू ईट अ फ्रूट. तो फ्रूट्स आप एटलीस्ट 1 से 2 फ्रूट अगर इंक्लूड करोगे, it will actually help you to prevent hypertension. Then the next part is basically, so whole grains, fruits, vegetables, low fat dairy products. Low fat dairy products में क्या आता है? घर का बनाया हुआ पनीर, घर का बनाया हुआ छेना, घर का बनाया हुआ दही और छाछ. हम जो पेशेंट्स को कहते हैं कि प्रोटीन्स इंक्लूड करो, वो बाहर का जाके पनीर ले लेते हैं, बाहर का दही ले लेते हैं. So those, if you eat full fat dairy products, they contain a lot of SFAs, that is saturated fatty acid. इससे क्या होगा, कॉन्स्टेंटली अगर आपका एसएफए इनटेक हाई रहेगा, आपको आर्टीरियल ब्लॉकेज होगा, जिससे आपको ब्लड प्रेशर का तो प्रॉब्लम होगा. उसके अलावा यू विल ऑल्सो हैव हार्ट अटैक एंड स्ट्रोक के कॉम्प्लिकेशंस इन द लॉन्ग रन. तो जितना हो पाता है ट्राई टू इंक्लूड घर का बनाया हुआ पनीर, घर का बनाया हुआ छेना एंड दही. सो डैश डाइट फोकसेस ऑन लो फैट डेयरी प्रोडक्ट्स. It also focuses on, it also limits the intake of added sugar. I hope you get the word added. इसको आप underline कीजिए red में. Why do we say added sugar? क्योंकि जैसे कि आप अगर जैगरी ले लो, बहुत लोग कहते हैं हम शुगर बन करके जैगरी ऐड करेंगे. नो, जैगरी, हनी, शुगर, हाई फ्रुक्टोज कॉर्न सिरप, मेपल सिरप, ये सारी चीजें हैं जो आपको बंद करनी है. रीड योर फूड लेबल्स. मार्केट इज बिकम सो इंटेलिजेंट, सो स्मार्ट. मार्केटिंग में कितना स्मार्ट हुआ है कि वो आपके फूड लेबल पे डायरेक्टली शुगर लिखेंगे नहीं. वो कैसा लिखेंगे? दे राइट हाई फ्रुक्टोज कॉर्न सिरप, डेक्सट्रोज, maltodextrin, ग्लूकोज, ये सारे टर्मिनोलॉजीज वो यूज करेंगे. सो यू हैव टू रीड फॉर, यू हैव टू लुक आउट फॉर दोज टर्म्स. अगर ये सारे टर्म्स आपके फूड लेबल्स पे आते हैं, मेंशन्ड है, तो आपको वो फूड नहीं खाना है. ओके, सो अवॉइड एडेड शुगर. चाय अगर पीना है तो चाय में आप शुगर ऐड करना कम करें. अगर आप 3 कप पीते हो तो 1 कप में ऐड करें, 2 कप में ऐड मत कीजिए फॉर अ वीक. देन सेकेंड वीक avoid the sugar completely. Slow down the frequency gradually. It only takes 21 days for you to change a habit, for your taste buds on the tongue to be getting adapted to a new taste. It only takes 21 days. Give yourself 21 days to form a new habit and to break the new habit. Okay, so break the old habit. So just these are few things. तो SFA intake आपको कम करना है through high fat dairy products. आपको added sugar कम करना है. Avoid salt. Okay, salt in the form of chips, your pizzas, बर्गर्स, फ्रेंच फ्राइज, ये सारे जो है उसमें एडेड सॉल्ट होते हैं, तो वो एडेड सॉल्ट आपको बंद करना है. लुक आउट फॉर MSG, मोनोसोडियम ग्लूटामेट, जो कि बहुत चाइनीज कुजीन में यूज किया जाता है. लुक आउट फॉर सोडियम बाइकार्बोनेट. सोडियम बाइकार्बोनेट आपके जैम्स में होगा, जेली में होगा, बटर में होगा. Okay, a lot of these food products have monosodium glutamate and sodium bicarbonate. So look out for these terms. जहाँ पे सोडियम है वो चीजें आपको बंद करनी है. So DASH diet focuses on only home cooked foods with enough fruits, vegetables, whole grains, good amount of nuts and seeds, good amount of beans and legumes, जैसे कि राजमा, चना. So if you're from North India, okay, so राजमा, चना is excellent. If you're from South India, you can always use छिलके वाली दाल. Do not go for polished dals. Go more for छिलके वाली दाल because they also contain fiber. ठीक है? So these are few things that you have to focus on. If you prefer a non-vegetarian food type, chicken, fish is what you can opt for. Avoid red meat. Okay, avoid pork or avoid mutton. These are the things you will have to avoid, and you can go more for fish and chicken. बहुत पेशेंट्स ये भी कहते हैं कि हम फिश चिकन तो खाते हैं लेकिन फ्राइड फॉर्म में खाते हैं. उसका फायदा बिल्कुल भी नहीं होगा. You'll have to change the method of cooking. What method of cooking are you using on a regular basis? बहुत लोग ये भी कहते हैं, बचपन से हमको आदत है, we eat fried chicken, we eat fried fish. No, do not do that. Change, break the habit. ठीक है? Now we come to the mineral intake. 3 minerals: potassium, magnesium, and calcium. So potassium is present in fruits, present in vegetables. लेकिन how do you do it? बहुत सारे जो हाउसवाइव्स है यहाँ पे वो अग्री करेंगे. वो क्या करते हैं, वो पहले फ्रूट्स या वेजिटेबल्स को काटते हैं फिर उसे धोते हैं. ये नहीं करना है, इससे पोटेशियम लॉस होगा पानी में. ओके, द पोटेशियम इज वाटर सोल्यूबल, निकल जाएगा. तो फर्स्ट यू हैव टू वॉश योर फ्रूट्स एंड वेजिटेबल्स, देन चॉप देम एंड देन ईट इट. All right, magnesium. What are your magnesium rich fruits and vegetables? Your nuts, beans, and vegetables. ओके बहुत लोगों की आदत है, हम उनको कहते हैं कि आपको कैश्यू नट्स भी अलाउड है। देखिए कैश्यू नट्स आप अवॉइड मत कीजिए, लेकिन क्वांटिटी कितना आप खा रहे हो वो भी बहुत इंपॉर्टेंट है। कैश्यू नट वो एक ऐसा नट है दैट पीपल कैन गो कैन जस्ट हॉग इट, वो पूरी आधी जार वो खत्म कर लेंगे। ओके सो quantity proportion is a very important. So nuts, beans, vegetables are magnesium rich. Calcium, all your dairy products. If you have lactose intolerance, अगर आपको दूध या दही सूट नहीं होता है, there are many vegetarian food options of calcium also available. जैसे कि मसूर दाल, राजमा, चना, okay, सोयाबीन is excellent. सोया मिल्क आप ले सकते हो, तो ये सारे जो है कैल्शियम रिच होते हैं, सो वो आप सारे इंक्लूड कीजिए। नाउ व्हाई पोटेशियम? पोटेशियम क्योंकि जो वाटर रिटेंशन होता है, जिससे हाइपरटेंशन होता है, पोटेशियम वो वाटर रिटेंशन को कम करता है, वो आपके यूरिन से पानी को निकाल देता है। सो दैट्स हाउ पोटेशियम कंट्रोल्स हाई ब्लड प्रेशर। वाई मैग्नीशियम? जो आपके ब्लड वेसल वॉल्स स्टिफ हो जाते हैं, वो स्टिफनेस को कम कर देता है, इलास्टिसिटी को बढ़ा देता है, जिससे आपका ब्लड प्रेशर कम होगा। Why calcium? For the same reason, because calcium also decreases the rigidity of the cell walls and improves the elasticity. Last and the most important thing is magnesium is very important because it improves the production of nitric oxide in the body. So if we see the next slide, I've actually highlighted the nitric oxide importance. आप में से I'm very sure your coaches must have told you start with nitric oxide exercises post meals. Okay, तो exercise करने से nitric oxide production improve होता है. Plus there are few foods, just make a note of these foods. कौन से foods से nitric oxide body में बढ़ता है. And why nitric oxide is directly correlated to hypertension and lowering blood pressure? Because it decreases the stiffness of your blood vessel walls. It decreases your arterial blockage. तो जिनको high cholesterol levels है, okay, और heart attack के chances है, वो उसे भी कम कर देता है nitric oxide. So do not underestimate the power of nitric oxide foods and exercises. So beetroot is a very good source of nitric oxide. Garlic. So the best way of eating garlic, if you are fine with eating raw garlic, how do you eat it? चॉप करके ऐसे ही नहीं आपको पूरा गार्लिक क्लोव को मुंह में डाल के गल्प डाउन नहीं करना है. दिस इज द रॉन्ग वे ऑफ ईटिंग गार्लिक. गार्लिक लीजिए, चॉप इट इनटू फाइन पीसेस, लीव इट ओपन इन ऑक्सीजन इन द एयर फॉर 5 minutes ताकि उसका जो एक्टिव कंपाउंड है वो एक्टिवेट हो जाए. Then drink it with water first thing in the morning on empty stomach. If you like the pungent flavor, if you're fine with it. If you're not fine with the pungent flavor, no problem. Garlic chutney बनाइए, garlic को तड़के में यूज कीजिए, no problem. So garlic is very important for production of nitric oxide. Leafy greens, spinach, make a spinach soup. अभी विंटर सीजन हो गया, विंटर सीजन में बहुत सारे हरे हरी सब्जियां मार्केट में अवेलेबल है. So try to make a paratha, a thepla, nice, you can make a nice raita. So methi, cabbage, sauteed cabbage with some, sesame seeds. Sesame seeds are very good sources of calcium. Kala, the black sesame seeds and the white sesame seeds. Uski chutney bhi achhi banti hai. So you can always, eat a nice palak thepla with a sesame chutney. So that can also be included for breakfast time. So these are the few foods, So if we move to the next slide. So you have pomegranate, okay? Don't make a pomegranate juice, eat the whole pomegranate because it improves your nitric oxide production. Nuts and seeds, okay? They contain arginine, which is a very important amino acid to improve the nitric oxide. But again, nuts and seeds, do not have them salted. Have them in, either, so if you have digestion related issues, you can soak and peel the almonds and eat it. If your digestive system is clear, आप उसे ऐसे ही raw form में भी खा सकते हैं. But just make sure they're not salted. Then the next slide, please. Watermelon. Okay, so बहुत questions आते हैं कि watermelon diabetes के patients को दे सकते हैं या नहीं. You are allowed to eat watermelon because watermelon has a very low glycemic load. Okay, उसका glycemic index थोड़ा high है, लेकिन glycemic load थोड़ा कम है. But so around 1 cup of watermelon is allowed. So आप around mid morning time, 11 a.m. in the morning, you can eat watermelon. You can add some nuts to it if you want for a good protein and carb ratio. So watermelon is a very good fruit which you can include in your diet with pomegranates to improve nitric oxide. तो इससे भी आपका blood pressure control में आएगा. Citrus fruits, oranges, lemons. Lemons, you can take one nice cup of lemon juice before your meals, 10 minutes prior to your meals. इससे आपका digestion भी clear होगा, plus आपका blood pressure भी control में आएगा. Plus आप salads पे भी नींबू, you can squeeze lemon and eat your salads. Grapefruit, they all improve nitric oxide production in the body. Next slide, please. Berries. Okay, so those of you who like eating strawberries, it's in season, go ahead, eat strawberries, blueberries, raspberries. They all reduce the risk of heart diseases. Coming to CoQ10, अक्सर हम सिर्फ, unfortunately not just us, but all over, globally, लोग खाली hypertension को associate करते हैं salt के साथ में. Salt को सिर्फ आप अगर focus दोगे, out of 10 factors, if you only focus on one and leave the other 9, your blood pressure will never come under control. You have to focus on all the 10 nutrients. So your potassium, magnesium, calcium, salt, sugar, fiber, proteins, and CoQ10. So CoQ10 is an antioxidant. And this antioxidant is very, very, agar aap non-vegetarian food type prefer karte ho, it's present in fish and chicken. Excellent sources of CoQ10. Otherwise, other vegetarian food products, I've mentioned it, okay? Spinach, cauliflower, broccoli, oranges, lentils, and peanuts. Lentils, I'm sure your coach must have told you about a grain-free meal. You can always make a nice lentil kebab or a nice lentil cutlet, have it with a bowl of soup or a bowl of, salads for dinner. It gives you the CoQ10. It controls your blood sugar levels. Blood sugar levels, if they are under control, you will not be having high blood pressure issue. So these are a few nutrients. Then calcium intake. This is something I really want to talk about. Okay, these are few options, I've actually highlighted here. Like you can use a masoor dal aap bana sakte ho, lentil kebabs bante hain. Moong dal chila, besan chila with dahi, if you include these things, it's a wonderful, grain-free option. Plus you get the calcium. When I speak about calcium, लोग अक्सर कहते हैं कि हम calcium supplements लेते हैं. Do not take calcium supplements for hypertension unless and until it is prescribed to you by your doctor. क्योंकि क्या होता है, अगर आप कैल्शियम सप्लीमेंट लेना स्टार्ट करोगे ना, यू विल स्टार्ट सीइंग रिवर्स इफेक्ट्स. आपको हार्ट अटैक के चांसेस बढ़ जाएंगे, क्योंकि जो कैल्शियम आप अगर सप्लीमेंट्स के फॉर्म में लोगे, वो कैल्शियम जाके आपके ब्लड वेसल वॉल पे डिपॉजिट होगा, ब्लॉकेज होगा, जिससे आपको हार्ट अटैक हो सकता है या ब्रेन स्ट्रोक हो सकता है. So go by the prescription of your doctor. Never take over the counter calcium supplements. आप कैल्शियम को नेचुरल तरीके से अपने डाइट में इंक्लूड कीजिए. हैव सोयाबीन्स एडिमा में. बहुत सारे लोगों को हम कहते हैं एडिमा में इंक्लूड कीजिए. दोस आर फ्रेश सोयाबीन्स या ग्रीन इन कलर, बॉईल करके नींबू डाल के उस पे जस्ट हैव इट इन योर डिनर टाइम विद अ नाइस ग्रीक योगर्ट. It will solve your calcium issues. So soya beans, soya milk, sesame seed chutney, as I told you, these are very good sources. Besan chila, moong dal cutlets. Try including legumes and seeds if you have lactose intolerance and cannot take milk for the calcium. But calcium supplements tabhi lijiyega only if your doctor tells you to. Yeah, so these are few your sources of calcium, so you can start taking them as well. Okay, so I've given tofu आप ले सकते हैं. Tofu instead of taking पनीर, अगर आपको lactose intolerance है, आप सोया पनीर जिसे हम tofu कहते हैं वो ले सकते हैं कैल्शियम के लिए. Nuts, almonds are very good sources of calcium. Beans like rajma, so bean salad बना के आप dinner time पे या lunch time पे ले सकते हैं. On the left, what you see is a nice sesame seed chutney, black sesame seed. Then you have besan chila. There is moong dal chilas, with a nice chutney. Moringa is a very good source of calcium. Why don't you use moringa? Moringa leaves, बहुत सारे लोगों के backyard में moringa के पत्ते होते हैं. उसकी चटनी बनाइए. Include moringa in your curries. Include you can make a nice drumstick soup. These are all calcium rich. So it is very important to include moringa and drumstick if you have hypertension issues. Then, so moringa also contains good potassium. So आप moringa leaves का थेपला बना सकते हैं. You can make a nice sabzi from drumstick. Drumstick soup बन सकता है. So these are various things. These are all functional foods. I'm sure you've heard of functional foods. They are foods that have certain nutrients and in a higher quantity compared to other foods. And they're specific to certain therapeutic cases. जैसे कि moringa में potassium ज़्यादा होता है, जो कि blood pressure control के लिए बहुत important है. So try including moringa, in your diet as well. Next slide, please, Neha. Yes. Now coming to tea and coffee consumption. Okay. There is no direct relation between high blood pressure and tea coffee consumption. लेकिन ये रिसर्च में देखा गया है कि अगर आप टी कॉफी कंटिन्यूस बेसिस पे लोगे तो टेम्पररी ब्रीफ पीरियड के लिए आपका ब्लड प्रेशर राइज हो सकता है. So if you already have a very fast heartbeat, okay, or you already have very high blood pressure, and अगर आप दिन में 10 से 12 कप चाय पीते हो, make sure that you're cutting down your tea intake. मैं ये नहीं कह रही हूँ कि कल से आपको एक ही कप चाय पीना है. एक हफ्ता दीजिए. From 10 cups you can come down to 5 cups of tea. Next week you can come down to 2 cups of tea. तो इससे आपका सिर्फ ब्लड प्रेशर कंट्रोल नहीं होगा, बल्कि आपका शुगर इंटेक भी कम होगा. Okay, so try moving more around, decreasing your tea and coffee consumption. Some patients only tell us, हमको खाना मत दीजिए, सिर्फ चाय कॉफी दीजिए. You're here to change habits at SugarFit. You're here to learn new habits so that you're able to reverse not just diabetes, but even blood pressure. Okay, so this was all about, hypertension and, certain nutrients. I hope, I've made myself clear, and, this would help you.
Thank you so much, Mahadev. It was a very short and crisp and to the point explanation. I hope everyone enjoyed and learned a lot over here. That's one of the major important topic which is more negligent. People think, okay, it's a blood pressure, we should neglect it. But then, with the diet, we can really work on it. You have to, as Mahadev said, that we have to work on our blood sugar readings. We have to stabilize them so that we can really get a better, control on our hypertension and the blood pressure levels also. So thank you so much, Mahadev. It was very insightful and Dr. Hardik has joined us, so we will be moving to Dr. Hardik. Just give
Hello,
me a
Neha.
second. Good morning, sir. Thank you so much for joining us.
Good morning. Good morning. It's my pleasure. Yeah.
So Dr. Hardik, as you all know, is one of the finest doctor along with us at SugarFit platform, and many of you might be working under him and his guidance. So he's channeling and dealing with the diabetes since long time and helping many people reducing and reversing their diabetes in a healthier way by working on their lifestyle. And we have a fine team of doctors who are passionately working and helping users, to work on their lifestyle instead of getting the dependency on the medicines. So welcome, Dr. Hardik, to the show. And there are a lot of questions being asked by the users which we have accumulated. And even if you have any questions with respect to the hypertension, please write down in the chat section. We will keep on taking the questions one by one. So please give me 1 second. I will start taking up the questions which we have accumulated through the, our questionnaire. So, Dr. Hadi, first question being asked by the user is that how can I know if I have hypertension and what are the symptoms I should look for?
Great, Neha. So that's a very, very commonly asked question, a very important question, and I think everybody should know about it. See, as we age, beyond 45, 50, our bodies tend to develop higher blood pressure. This is due to a change in the stiffening of the stiffness of the blood vessels of our body, and also it is related to the heart function. So a lot of times we do not know that we are developing higher blood pressure. However, some of the common symptoms that usually people present with are occasional headaches, sometimes frontal side, the headaches in the frontal side of the head, or sometimes occipital, that is the back side of the head. Secondly, patients sometimes also present with nosebleeds. Nosebleeds are also one of the common scenarios where where patients present with high blood pressure. Also, giddiness I have seen is associated with very high blood pressure. And also we must keep in mind that sometimes there are no symptoms at all, and that is why monitoring of your blood pressure, at least, even if somebody is not diagnosed with blood pressure yet, at least once a year it should be checked. Beyond 50 years of age, at least once a year it should be checked by your doctor manually, and one should keep a watch on the blood pressure.
So, the next question what we have is what are the risk factors associated with hypertension?
Right, right, right. Very important. So, one of the important risk factors is advancing age. As we age, as we grow older, we tend to develop hypertension, especially when we go beyond the age of 50 years of age. Secondly, our body weight also plays a very important role in terms of our blood pressure. Um, if we are beyond the BMI of 25, that is, if we are overweight, then we tend to develop high blood pressure. Family history also plays a role. That is the third thing, family history. If there is family history of high BP in our parents or grandparents, then we must be careful about our blood pressure as well, and we must keep a watch over our blood pressure values. Fourth thing is as a race, as a population, we Indians are more prone to develop higher blood pressure beyond the age of 50 years. And one of the most important thing is the function of the kidneys. That is that is a lot of times that is missed by people. The function of the kidneys, due to growing age, we tend to develop our lesser our kidneys tend to function a bit lesser as we age, just because aging tends to is associated with lesser function of all the organs, decreasing function of all the organs, and it is happening very gradually. But sometimes due to some other factors, the kidney function is affected due to our environmental settings, due to some infections, due to some nutritional deficiencies, and also due to genetic factors. The kidney function is lesser, and because of that also we tend to develop high BP, high blood pressure. Now, one of the factors is also our diet. If we tend to have high sodium intake or high salt intake in our diet, then that also leads to higher chances of developing high blood pressure. Salt intake of more than 3 gram per day is associated with high blood pressure. Secondly, excessive alcohol consumption. If there is alcohol consumption in our routine, put us at a high risk of developing high blood pressure. Less physical activity. One of the most important risk factors we see is less physical activity, that tends to put us at a higher risk of developing high BP. And also insufficient sleep. So that also is one very important lifestyle factor that leads to high BP. So these are some of the factors.
That was quite insightful, sir. Sir, there is one question being asked by the audience that my BP is 120 by 67. Can I have a BP? Do I assume myself as a hypertensive patient?
Okay, so when it comes to values, 120 by 67, systolic 120 and 67 diastolic, it falls in the normal blood pressure ranges, so that is completely fine. However, one needs to be aware if the one needs to be alerted if the blood pressure is going beyond 120. So that is one thing that we advise, that may be a beginning of higher blood pressure. There are two different guidelines: American College of Cardiology and American Society of and European Society of Hypertension, ESHNC. So basically, they have different cutoffs, but we usually advise that when the office BP, when the doctors check the BP manually, less than 120 and less than 80 tends to be normal blood pressure. And when it goes beyond 120, we label it as elevated blood pressure, but not higher blood pressure that needs treatment, but that is one alerting point that one should keep in mind. And yeah, so that is there.
How many readings one should take to take a call that, I'm hypertensive, or, because sometimes one or two readings can be high. But how to really come to the conclusion that you are hypertensive, and how many readings one should take for how many days? We can't hear you.
Yeah, so that's a very, very useful question in terms of diagnosing the a person as a hypertensive. So basically, we advise that if the monitoring is being done at home, if the BP is being checked at home, that we call as home BP, home blood pressure. So that has to be checked at least 5 days in a row. And that has to be there should not be any factors that would have affected the higher blood pressure. Basically, there should not be any tea or coffee intake just prior to checking the blood pressure. The sleep should have been sufficient. The position of checking the BP should be, the person should be checking in upright position by sitting in a chair and keeping that automatic blood pressure machine on the desk in front of him. And should be checked once in the morning and once in the night before sleeping. Once in the morning just after waking up, before the breakfast, that is before the intake of any tea or coffee, and at night at the time of going to bed. So these two timings should be kept in mind, and at least 5 days in a row it should be checked. And if those values are elevated, then they should consult their doctor and get it checked by their doctors also, and so that they can be diagnosed and managed accordingly.
So much, sir. Sir, I think it's very insightful and very, very, clear that how people should check and understand. Now, there is age-related hypertension differences and variations also. So, what do you, would you like to give some more clarity and throw some light on this one?
Right. So actually, how it is, see, age-related factors, age-related BP cutoff or the blood pressure cutoffs are basically so. What happens is age is definitely one factor in developing the blood pressure, but when it comes to diagnosing someone as hypertensive or somebody as having hypertension, the age is not really like a not a major cutoff, but yes, above 70 years of age, a systolic BP of up to 150 is acceptable, and diastolic BP of up to 90 is acceptable. And this is due to the reason is that as we age, the higher the upper BP, that is the systolic blood pressure, that tends to increase, and that is mainly due to the functioning of the body, the aging, and also due to the stiffening of the arteries. So some people may have only elevated systolic blood pressure, that is their upper BP, that is systolic BP, is up to 150, but the diastolic BP is sometimes 80 or 85. So that should be treated accordingly. However, in patients beyond 70 years of age, that can be accepted as normal if they are not having any symptoms and if other factors are considered. So that actually is one thing that that is only one thing that we need to that the patient should know, that only beyond 70 the acceptance is up to 150 in systolic, but that is not really, that does not apply to less than patients who are less than 70 years of age. So that's one thing.
What are the potential complications of untreated hypertension?
Mhm. Right. So, a lot of times patients develop due to high blood pressure. See, basically, high blood pressure affects four main organs. One thing is one organ is brain. Secondly, retina, that is the back of the eye. Third is our heart, and fourth is our kidneys. And in among these four, heart and kidneys are working as primary organs to maintain our blood pressure somehow. And now, what happens is if the elevated blood pressure stays for a long time, one is at a higher risk of having brain stroke, that is ischemic infarct or brain hemorrhages. Secondly, retinopathy, that is hypertensive retinopathy, can develop. Third thing is higher chances or higher incidences of heart attack. And the fourth thing is kidney issues, that is kidney failure or reduced kidney function. So these four main organs are affected when high blood pressure is not treated, when it is elevated for a long time and not managed properly.
So, asked by the people is can stress or anxiety affect blood pressure?
Yes, that's absolutely true. Stress and anxiety can lead to elevated blood pressure levels. The reason behind that is the stress. Whenever we are under stress, we are having a stress response or a fight or flight response in our body that leads to elevated heart rate, perspiration, increased rate of breathing. Also, it can affect us mentally, psychologically. Our sleep tends to be disturbed. We wake up sometimes in the middle of the night, or we face difficulty in falling asleep. And all these factors they lead to elevated blood pressure levels also.
Asks us that what is the impact of smoking on blood pressure?
Oh, yeah, very important, very important. This habit of smoking cigarettes, along with even it is one of the studies also say that even smoking, hookah, which has been very popular these days, even vaping that has taken over as a, these days an alternative of smokeless cigarettes and things like that. So definitely smoking affects our blood pressure levels. It elevates our blood pressure levels. The reason behind that is smoking all these things like nicotine, the substance called nicotine, which is present in tobacco, it leads to constriction of our arteries, narrowing of our arteries and blood vessels, and that leads to higher blood pressure. And this is how it affects our blood pressure values, and as a result, it can also affect our kidneys and heart. Yeah.
Absolutely. I think that was a very well explained answer. I hope you all can understand. Now, another question being asked is that I think we have covered also, is hypertension heredity, yes or no?
Yeah, hypertension, yes, it can run in the family if our family history is strong. If there is a history of high BP in our parents or grandparents, that tends to reflect in our, blood pressure values as well.
Weight management also help in managing the both blood pressure and the blood sugar
Oh yes.
levels.
Oh yes, absolutely, absolutely. Weight management, weight, it plays very, very important role in both management of diabetes and the management of blood pressure. The reason behind that is as the weight increases, for example, if there is a higher percentage of fat in our body, that leads to higher chances of insulin resistance, and that leads to uncontrolled sugar levels or more chances of developing diabetes. Also, it is very well known that with every 1 kilo of reduction in the weight can lead to reduction of 1 millimeter mercury reduction in the blood pressure as well. So, for example, if you lose 4 to 5 kilos of body weight, you may see drop of 4 to 5 units in your blood pressure readings. So, yes, weight management will help in both in the management, in the better management of both of these issues, that is diabetes and blood pressure.
Question being asked that whether one should avoid high intensity exercise when they have hypertension and diabetes.
Right. So with high intensity exercises, what happens is momentarily, transiently, the blood pressure may increase. That is due to the fact that while you're exercising, there is a higher, pulse rate, faster pulse rate. The heart beats at a faster pace. And secondly, there is constriction and relaxation of our blood vessels of all over the body. So momentarily, the blood pressure may increase, and hence, if somebody is having blood pressure, medicines, and if somebody is having hypertension, they should take up the high intensity exercises with caution, and graded exercises should be included in their routine. For example, they should gradually increase the intensity of the exercises. They should consult their doctor frequently and get themselves checked so that they can decide on how they can elevate the level of their their exercises and everything.
Next question is by Saurabh Patil is that generally BP increases at doctor clinic called the white coat BP and home BP device show too much fluctuations even
Right.
taken back to back. How
Yes.
to conclude and will ambulatory BP method will help for exact diagnosis?
It's a wonderful question. So basically, sir, when it comes to higher BP values in the office, when you're sitting in the doctor's office, it does have it is called a phenomenon of white coat hypertension. Now, this white coat hypertension, yes, it can actually affect our health, and many recent studies have pointed out that white coat hypertension also should be taken seriously. It also should be treated because if you see practically, when you're in front of a doctor, when you're in the doctor's clinic, there is anxiety, there is a bit of a stress, and certainly such a stress or anxiety you may be facing at home due to certain situations. When you are at work, you may be facing certain a similar kind of stress or anxiety, and that also might be elevating your blood pressure. So white coat hypertension should be taken seriously, should be managed at least with lifestyle modifications in the beginning, and with the help of ambulatory BP monitoring, that is 24 hours BP monitoring. There is a separate device which can be applied to your arm, and that checks your blood pressure every 15 minutes for 24 hours. And that device is giving a very accurate reading of your blood pressure levels, and that also checks your BP while you are asleep at night. Very commonly, it is seen that early morning by 5:36 a.m., our BP increases, and that can lead to complications and issues like heart attack and brain stroke. That is very commonly seen. So, this phenomenon of higher BP readings in the morning is often missed because at that time we are generally sleeping and we are not checking the BP. So, ambulatory BP monitoring can actually give us a very deep insight about how your blood pressure is throughout those 24 hours. And if somebody is taking medicines for treatment of their blood pressure, then we also know how the BP is throughout the night. Sometimes some patients tend to have lower BP readings in the night when they are asleep. So we know how the that definitely gives us a better insight into their blood pressure readings, and we can manage their medicines and lifestyle accordingly. So very very good question. Ambulatory BP monitoring is one of the diagnostic modalities that we advise these days for patients who are young, for patients who are newly diagnosed with hypertension, and for patients who are having uncontrolled hypertension, even on medicines. So yes, thank you.
Thank you, sir. Next question is by Dr. Anuradha that isolated systolic hypertension. What is it? Can you just please help us in understanding it?
Right. Very, very good question, ma'am. So basically, isolated systolic hypertension is where the only systolic blood pressure, only the systolic reading is on the higher side, that is more than 140, but the diastolic reading is up to 80 or 85. So this is this can be classified as isolated systolic hypertension. Many factors can be associated with isolated systolic hypertension. One of the most important factor is age, secondly salt intake, third is anxiety as well, and the fourth is lack of physical activity. So these factors should be looked into for that person. And if the isolated systolic hypertension is staying more than 140 consistently, then it can be treated with a basic antihypertensive medicines, but lifestyle modification should be looked into, and so that it can prevent further complication. So yeah.
So next question is by Raja. Can the heart rate increases due to anxiety? Is it dangerous? How to know is this due to problem or anxiety?
Right. So heart rate, yes, our heart rate is normally the range of our heart rate is basically 60 beats per minute to 100 beats per minute. Due to anxiety, for many people, it can lead to higher heart rates above 100 beats per minute at rest, and this can also sometimes affect our organs, and can lead to certain complications. Management of increased heart rate, should be done. Usually we are seeing these days is that in younger patients, in younger people, there are this is one of the phenomenon that is seen, that there is increased sympathetic activity, and that is leading to increased heart rate, and that is leading to sometimes development of high blood pressure and other complications. So lifestyle modifications in terms of better sleep, mindfulness, or mindful meditation can be undertaken. And if there are habits like smoking and alcohol, they should be looked into and they should be cut down or avoided. And if the weight is on the higher side, and that also can be managed, that should be managed by by reducing weight and bringing the BMI lesser than 25. So yeah.
Thank you so much, sir. Um, there's one more question. There are a lot of questions, I think a lot of interesting questions, but I'm just
Yes.
trying to take one by one, whatever is like, more
Sure.
relevant and associated with the topic. So, what are the potential complications of untreated hypertension? How to deal with it? There are many users, and the many patients which come to us and they don't take the medication because we have a lifestyle, dependency on the BP medication. So, can one get rid of it? And how to, understand the complications associated with the hypertension and how one can treat them?
Right. So, as I mentioned, one of the complications of higher blood pressure, uncontrolled high blood pressure, is retinopathy. So, once a year, any person who is having hypertension, once a year, the retina should be checked. Secondly, brain strokes, that is blockage of the one of the blood vessels which is supplying the brain, can get blocked due to high blood pressure, and that can lead to reduced function in that part of the brain, which manifests on our body in symptoms like slurring of speech, weakness of one or both one arm and one leg or one side of the body, and sometimes giddiness also is one of those symptoms. So basically, that should be managed by controlling blood pressure. And third organ that can be affected by high blood pressure, that is heart. Increased chances of heart attacks are seen because of uncontrolled blood pressure. And the fourth organ, that is kidneys, which are affected due to high blood pressure. Their function reduces, the kidneys get damaged from inside, and it is seen in the urine as passing of the protein or albumin in the urine, and that's also called as hypertensive nephropathy. So these are some of the most common complications that we are seeing in patients who are having uncontrolled high blood pressure. Now, to manage it, obviously we need to get the retinas checked once a year. We need to check the blood pressures at least every 6 months for those patients who are taking medications for their blood pressure. And they should at least do an ECG, that is electrocardiogram, at least once a year in their annual health checkup.
There's one more question, that is, there is any relationship between the heart rate and the blood pressure?
Yes, absolutely. There is a relationship between heart rate and the blood pressure. If the heart rate goes beyond 100 or 110 while you are resting, or if at all, sometimes when you are, working out, the blood pressure can get mildly elevated, and it can go beyond 140.
Okay. And there's one more question by Harish, that what is the ambulatory BP monitoring machine, and what is its use?
Right. So ambulatory BP machine is the machine that basically is having a cuff that we usually tie to the upper arm, and it is more portable, that can be carried around, and that usually is tied to the upper arm and kept with the patient for 24 hours. So that is checking your blood pressure automatically every 15 minutes and records that data, and at the end of 24 hours it gives you a proper graph, and that graph is more informative about that patient's blood pressure readings. It also, the machine also checks the blood pressure while you're asleep. So that gives a very good idea about the blood pressure readings of throughout the day and at night. So that is the use of ambulatory BP machine.
Thank you. So we will take one more question, is that how the high impacts the blood pressure?
Sorry, Neha, I lost you in between. How the high?
Can you hear me? How the high blood sugar readings
Ah,
impacts the blood pressure?
right, right. So, very important question. See, whenever when the blood sugar is on the higher side, what happens is, in simple words, it can make the blood thicker, and it can lead to a little bit elevated blood pressure. And this can, together, both of these things, that is uncontrolled blood sugar and uncontrolled blood pressure, the both of these issues can lead to higher chances of damage to the kidneys, to the retinas, to the heart, and to the brain. So absolutely, higher blood sugar levels should be treated uh, directly. They may not be related very closely. A lot of people have higher blood sugars, but they do not have higher elevated or higher or problematic blood pressure. But there are associations where higher blood sugar levels, they affect kidneys, and that can lead to elevated blood pressure. So it can happen indirectly. However, if the kidneys are healthy, that may not be seen always. So that is one thing.
Thank you so much. So it was
Thank you.
a eye-opening session, and I guess most of our doubts have been clarified. Thank you so much for coming and clarifying our doubts and helping us and getting
My
more
pleasure.
clarity on the topic.
Thank
So
you so much, Neha, for
it's
giving me this
wonderful to have
opportunity.
you here. Thank
Yeah,
you so
it's
much,
my
sir.
pleasure. Thank you so much. Have a good day.
Thank
Have
you,
a good day,
sir.
everyone. Take care. Thank you.
Good day, everyone. And if there is any question related to the dash diet, you can please go ahead and ask me uh, any of the question that you have related to the dash diet. Madhe, you are here. Can you quickly give a brief on what we have discussed today? The takeaway pointers which can be shared with the audience to help them in understanding and keeping these pointers in mind, how to reduce the blood pressure with the diet. Just the
Absolutely.
key pointers.
Sure. So the first thing you have to understand that it's not just salt that is related to high blood pressure. The salt that we use in regular cooking, you don't have to cut that down. जो extra salt आप दूसरे processed food से packaged food से आप खाते हो, like chips and all the frozen pizzas and burgers, that is what you have to avoid. Second is sugar intake. Cut down your sugar intake so that you're able to control your high blood pressure levels. Make sure you're including substantial amounts of colors on the plate. Your plate should always look colorful. तो जितना कलरफुल आपका प्लेट लगेगा, and if you're following the tea plate method, so you will always be able to control your high blood pressure levels, and you can also prevent or delay it. So just be a little physically active, do your exercises, do the strength training workouts along with the regular walking, have a good night's sleep, and make sure you're doing some breathing and relaxation techniques to relax yourself, your body and mind. So when you're at peace with yourself, your blood pressure will also be under control. That's it. That's all I want to tell you.
Absolutely, Mahadev. And it was, I think, a wonderful session. We have really understood the concept of hypertension, how it is related to diabetes, how the diet can play a major role, and why the exercise is so important. So, just we will share the recording for the session. Please keep this in mind, go through it once again. And these are the small changes we can make in our day-to-day life to get a better, healthier, and good longevity. So please take care of this. And if you have any doubt related to it, you can even reach out to me or the coach and keep yourself active on the premium group. We are trying to just spread a lot of motivation over there. So if you just be active over there, we are sure that you will be very easily able to reduce your blood sugar readings, reverse your diabetes, and that's what we want, and that's why we are here for. Wishing you all a very happy and healthy Sunday. Please make sure that you are detoxifying your system. It's very important. It seems like, difficult, but it's not. We have detoxification and fasting in each and every culture. Ramadan is coming, and we know that why it is so important. It's a holy month. It's a month to cleanse and, completely detoxify your system. We have Navratri is coming. So Hindus, they are doing the Navratri. So even the Easter is coming. So in every culture, it doesn't matter whether you're Muslim, you're Hindu, you're Sikh, you are, Christian, we all have the way of cleansing, and that has been there in our mythology since ages. So please respect, instead of just thinking about the eating, eat right, think about your system, give the, gratitude. Likewise, we can't keep working throughout the day or throughout the week. We need a day rest, we need a week off. So our body also need a rest. So please respect and listen to it. Thank you so much and have a wonderful day ahead. Thank you so much, Mahadev. Looking for many more sessions. And we have received a wonderful response for today's session. And I hope we will keep on getting many more sessions like this. Keep joining us, keep giving us nice talks, which our users require for the more motivation and the awareness. Thank you so much. Have a wonderful day. And I want that every day you will show 1 to 2 readings on the premium group and your plate pictures. Thanks a lot.
That's fine. I missed the session. If you could, is it the recording will be available?
Yeah, so give us some time. I have to convert the entire recording and compress it, and then we'll share it as soon as possible with you. Most probably by tomorrow morning, I will give it to you. So please.
It will be sent on the WhatsApp.
No, all the recordings, everything we share on the premium group. So please stay connected over there because there are 30,000 base of the users. So we just send everything over there. It's very difficult to send separately.
Where exactly will be receiving?
So when we open the chat box, when we open our app, there are 2 chats interface. One is with the coach, my coach, and one is the premium group. So please stay connected to the premium group. All the information will be provided over there.
Okay. And could you just brief me little bit about what is DASH diet?
So DASH diet is basically a diet where we just cut down all the sodium intake, because sodium leads to a lot of water retention. It impacts your blood sugar readings as well as your blood pressure. So to reduce your blood pressure and hypertension, we have to reduce the amount of the salt we are consuming on a day-to-day life. It's not just the table salt what we are eating, but there are many foods which we has the salt and the natural sodium in that. So basically, all the packet food, if you look at the packet and the processed food, what we get in the market, it has the highest amount of sodium inside that. How much we can consume in a day is 3 teaspoons. But what we end up is getting 10 to 12 teaspoons. If we don't even realize that how much salt and the sodium we get from the chips or we get from the sauce, table sauce, what we use, there are many a number of products. So always flip the the product and see that what is the potassium level inside in that particular pack, what is the sodium level. If it is on the higher side, please avoid that. It should not be consumed. And that's why we are doing this cleansing process, also the gut challenge, so that we reduce the amount of processed food, the higher amount of sodium, and this helps in body to, the more the amount of sodium you take in the diet, what happens? It leaches away the water from the cells, dehydrating them. And the more number of cells starts dying inside the system, making you more sick, making your immunity go down, and you even end up getting a lot of free radicals, which is one of the major reasons to get the cancer in human body. And that's the reason we are getting a lot of cancer, cases nowadays. It's just because we are having dependency on too much of outside food and the processed food. Anything which is packed, which is processed, has very high amount of sodium. And Dash Diet here helps you in reducing the amount of sodium intake and to prevent the heart diseases and to prevent the blood pressure and hypertension. So that's it. I
Okay.
hope
So like behind the packet, when you check the sodium content, how much is the limit that we should be looking for?
it should be within like 2 digits, but always in the very high number. It's always like, 100, 120, 130, should not exceed more than 15 to 20 milligrams. But generally, it's not the case. If you see any packet, it's in always 2 or 3 digits, majorly in the 3 digits number, which is way beyond the normal, allowance for the day. We have 2300 milligram recommendation for a person per day if they don't have any kidney or the heart related concerns or BP issues. Even for them, they are like more lesser than that. But 2300 milligrams is what you can take in a day, which we get from fruits, which we get from vegetables, which we get from pulses, which we get from lot many other food. What we are consuming, we are not even aware. It's not just the table salt. It's a hidden sodium, the natural sodium which is present in all the food items. So please be careful, eat less salt. Try not to add salt or any of the chaat masala on top of the fruits. Instead that you can have just the fruit raw itself, which also has its own taste and texture. So please, even we can sprinkle the cinnamon. Cinnamon is one of the much better way of adding the normal, taste and flavor to your fruits. And that helps in reducing the glycemic index also.
And in children also, when we have to restrict the children from the junk food, how do we kind of convince them when we talk about the sodium? They do not understand, right?
We
So
don't need
whether
to talk about so there should be balance in everything. I'm also a mother of two, and I can understand being a mother of a teenager. It's very difficult to convince them because they have their own peer pressure now. So it's not about completely stopping them, but bringing in that discipline that, okay, once in 15 days or once in a month only, we will allow you to have this particular food. And when you are having it, you have to walk, you have to run, you have to do some activity so that you are burning it off, and drinking a lot of water post the meals consumption so that we can rehydrate ourselves. And there has to be a discipline every day, pampering your child with by giving the chips, Maggie. Just you as a mother need to have that discipline and the complete, plan that, okay, once in 10 days, I'm going to allow you to cheat and you decide what you want to eat. Even if you're taking, okay, pizza for the weekend binge, before that, you have to take the salad bowl. That's a rule in my house. I always tell my kids that, I don't mind you eating the pizza, but it has to be a sourdough pizza instead of the normal pizza. I don't give them the pizza with the wheat or the maida bread. So I always ask for the sourdough pizza. Even when they say that, okay, we have to eat the pizza, we always say, okay, eat a bowl full of salads and then go ahead and have the pizza. Definitely they will be more full with the fiber, and then when they go to the pizza, they will eat in moderation and in a small quantity. So we as a mother, we have to be smart and we have to play tricks in the games, which makes them more clear about the concepts, and we have to guide them that what is good for them, what is bad for them, related to their if they are girls, tell them about their skin. You are getting pimples, you are getting your skin will become pale. Talk about the favorite actress or actresses, or for the boys you can talk about their favorite sports person, because that always helps them in understanding and relating it to the facts better. And even like a very good example is like Akshay Kumar is there. They all follow the film stars, so that how he is always having that discipline in the life. There are a lot of motivational videos on the YouTube and social media where people are talking. The actors are talking about their own routine. Even Virat Kohli, he always talk about his routine, how he avoids the non-veg and the healthy stuff, because that was impacting his performance and overall. And again, the more they eat the unhealthier food, the packet food, there will be too much of blood sugar fluctuations in the body, and that's more harmful because the capability of the brain to retain things comes down. And the more the fluctuations, your productivity level also decreases. So they need to understand all these aspects. And there is a one lady called Glucose Goddess who explain all these concepts very nicely, very simply in the YouTube. So you as a parent, you can watch and kids will sit along, and they can watch you too. So I always play and Chromecast things on my, or play it on the Netflix or Amazon stick on my TV, so that, kids around me can also listen to it. So sometimes
can
they
you name
come
that
and say,
show? Can you
Sorry?
name the show? Name the show.
Yeah, sure. It's a glucose goddess. You can, ask them to follow that.
Okay. And what is the full form of DASH?
Dash is it's a diet plan basically where you are reducing the salt intake. So it is called the diabetic low acidic food, which is helping you in reducing the byproducts.
Okay, I'm like the initials DASH. What does it stand for? Kind of nothing special,
No. It's
specific. Yeah.
basically how the reduction in the salt intake helping you to reduce the overall heart related concerns.
So acidity is related to the salt intake.
Absolutely. When your body is too much acidic, when your body leaches out the water because of the high salt intake, it also leads to the acidity and many other control. So basically, it's a dietary approach how to stop the hypertension. That's what
And
the
the
sorry for
red meat has high levels of sodium, right?
very high sodium. All the animal products have very high amount of sodium. That's why we restrict it to 3 days a week. We should not exceed more than that. It reduces your hydration level. Red meat or the even having high amount of cholesterol. They have a lot of bad fats which the body is not able to process. They release a lot of free radicals at the end, and these free radicals start eating up your cells, start making your body much more sicker, and makes your immune system more, low on the lower side and making you more prone to diseases. So I
If
just
you are Yeah, if our body is already reached to a stage where there is a lot of inflammation in every part of your body, and we can experience it, that it comes to a level where we can't even eat a normal food. The automatically the body starts, allowing you to intake that normal food. It stops you from
normal food,
eating.
what is the
You feel
definition
full
of the
all the
normal
time.
food? Is like, it's like having a healthier food, eating a
Yeah.
balanced diet, having the proteins, carbohydrates in a moderation, and more of the green leafy vegetables and colorful, food in your plate. It's
Yeah.
not about the process, it's not about the packed food. It's about the natural food which we are getting from the trees, which is grown locally, which is fresh, and that, helps us in getting more nourishment.
If there
So
is a lot of inflammation in the body and it has reached to a level, since we are like
So
coming to a
the
late,
cleansing what we are doing is the same reason, because
yeah.
diabetes comes with a lot of inflammation. It comes with a lot of resistance. And when we
Mm.
are doing the cleansing process, why we are doing it? So that we can reduce the inflammation, we can reduce the acidity in the system, we can make the body more alkaline.
Okay, as you mentioned that we are damaging lot of cells, right? Lot of sodium intake will lead to cell damage and free radicals, right? So that is reversible. That stage is reversible.
Absolutely reversible. You change the way of eating, you change your lifestyle. It's all a lifestyle oriented health conditions which are completely, we have given it the birth. So if you as a person work on your lifestyle, improve it, as a human being, we always know that this is wrong. We should not eat a lot of, junk. But what we do, okay, aaj kha lete hain, we will eat today, but tomorrow we will not. Then they never ends. We keep on doing those cheatings again and again, and there is no limit to it. So you have to break that bar. You have to decide that how and when you are going to take it. Ma'am, I'm sorry, there are
Yeah.
more people who are asking for the
Thank you
questions.
so
So
much. Yeah.
I have to
Thank you
take
so much. Yeah.
one by one the questions.
Yes, thank you so much. Yeah.
Most welcome. So, Mr. Prasad, you have another question. I think I will just quickly unmute you. Can you unmute yourself and talk? You
Yeah,
have any
yeah,
question?
yeah. That one of the things I heard was like regarding the micronutrients. So where in that course we'll start getting these details of like what should be the food intake? Because I recently joined last week only I joined the sugar reversal course.
Sir, I'm pardon, your voice is breaking a lot. Can you just come again?
Yeah, 1 second. Let me. I was just telling that I joined last week only regarding the course. Are you clear now?
Yeah, I'm able to hear you. I'm trying to make out the meaning of the question.
The course. Today we are talking about inflammation. Today we talked about uh, micronutrients and all. Where can we get when is this process starts? Like I started last week the course. So when this process starts, like regarding the micronutrients, what we need to take,
When we plan
and
your diet plan, so when you start the course, first call is
you're
the
not
dietary.
audible.
Am I not audible?
You're not audible. Or else let me take my mic off 1 second.
Can you hear me? Hello, am I audible? I will quickly give the answer. Can you hear me, Mr. Prasad?
Yeah, I'm audible now.
Yeah, you are audible. So we plan the diets, there are two calls in the beginning that happens once you join the program. First is your lifestyle recall, where we take your lifestyle, we understand your body and your, lifestyle which has been so far. And second call where we discuss and decide your diet plan. So in your diet plan, when our coach is planning the diet, she's taking care of both the aspects, the micronutrients and the macronutrients. That's why diet plan, the proteins, carbohydrates, your fat intakes, everything is mentioned over there. So we are taking care of all these food. We are adding up the superfoods gradually in the diet because we cannot, overwhelm you with so many changes. So you need not to worry about it. All these, ingredients have been added up to the diet plan. You have to just follow the diet. You have to make sure that you are eating more balanced food. And if in case you are finding any difficulty in following the diet plan, please be very open to the coach and discuss that, okay, this is something not working for me. How can you provide me some other alternative? And I'm sure she will give you with more options to follow. So I hope I could answer the question. Anything else? Thank you so much, everyone. I just hope I'm trying from my side to keep the groups active, to keep you all motivated. Please keep on pouring in the logs because without your contribution, I don't think we will be able to achieve the results. So please stay active, keep on joining. Even if you're feeling like, who are experiencing the detox, I would like you to come up and share your experience in the groups. And you can even talk over here because your experience can encourage many more people to take this step further. It's a fasting, it's a sort of like cleansing, where we are giving a rest to the system and we are helping the system to rejuvenate and recover and heal itself. And that's one of the best way and the best medicine to completely give the body the support it requires. We all need support, we all need a helping hand. It's our own body, we can't neglect it like this. So please listen and of an hour and work towards that. Yeah, Mr. Shaikh, but 1 second, I'm just unmuting you. Can you unmute yourself, Abdul?
Yeah.
Yes, sir.
Hi, madam. How are
Hello.
you?
I'm good. How are you, sir?
Yeah, nice to talk to you. Madam, tomorrow Ramzan is going to start. So, is there anything from your side to advise me?
We are going to share the Ramadan diet plan with you. So don't worry, I will share it in the group. It's just the thing is avoid the fried food, avoid very, very heavy meals because that makes you more sluggish. Keep on sipping the water, chia seeds water at night and the window where you can eat. Try to eat more of the fruits which will hydrate you. Try to eat the grilled and the roasted food instead of the dry fruit. Red meats make your body very, very sluggish. So please don't do that because your system is shut for a particular time window. And when you are eating the red meat, it takes longer time to digest and keep you feel more sluggish. And that makes body feel more weak. You get more brain fog. You feel, completely blank. So there, it's important to eat light and something which is high in fiber and fat. So you can mute yourself by talking.
Okay.
I hope you can understand. I'm going to share the entire plan with you. You can go through it. I will be sharing it today if you are going, and I wish you a very
Okay.
happy Ramadan and all the very
Thank
best.
you, madam. Thanks a lot. And I also pray for you and for all the activities. Thanks a lot and God bless.
Thank you. So if there is any other concern, please you keep over there and respond back to as many queries I can. And if there is anything, I drop my email ID also for something very urgent, you can write down over there. Wishing you all the very best. Stay healthy. Think about yourself. Love yourself because that's what you need to flourish and to nourish your system. So please take care and have a very happy and wonderful, peaceful Sunday. Thank you.